So can you just tell me a little bit about yourself? Like what's your name, when and where you were born? Where are you living now?
My name is Esther Sunchild, and I'm from Thunderchild First Nations. I'm a band member of Thunderchild. I was born in St. Walburg, Saskatchewan, but I was, like I said, born and raised in Thunderchild. And I work full-time in Waterhen Lake First Nations, and I live there during the week, but I also have a house in North Balfour where I go to sometimes as well.
Hmm. So do you remember what you thought when you first heard about the coronavirus?
Well, when I first heard of the coronavirus, it first originated in Wuhan, China, and when I heard about it on the news, I saw it them like how devastating for them. I never thought it would come to our country, but it did. When I started hearing that it was going to, when I started hearing about it, how it was going to different countries besides Canada, I knew in the back of my mind it was going to be a pandemic.
Hmm.
And life was going to change.
Yeah.
Yes.
And when did your life start to change?
My life started changing in the beginning of March. The beginning of March. It was, I knew it was coming, so I was trying to get things done before it actually was declared a pandemic. Trying to get things in order. Yeah, so, it was almost like seeing your family for the last time for a little bit, kind of. It was in my mind. So I did see my grandchildren and my daughter and my sons, and then I started preparing for the pandemic. Getting some groceries and putting at least 2 weeks supply of groceries in the cupboard, kind of thing. Yeah, self-isolating, all that, masking, hand sanitizing, of course, the social distancing and social isolation.
And how did your community respond to the virus?
How did the community respond to the virus? Well, because it was in the media, and the province of Saskatchewan and Northern Tribal Health Authority, we were meeting up with NITHA through teleconferences once every week, and they were showing us videos on how to properly gown and use a face mask, face shield, and how to do testing. And they were very diligent with that. They had that meeting actually twice a week with the nurses. So I think and of course the media, what we were reading, right, was becoming more serious. I think the community was obviously reacted to it, and we went on the radio stations, the health nurses, and we sat along with the health director, the chief, and made announcements and what to expect. So, yeah, there was I can't say a positive reaction, but people were aware of it, right? Yeah.
Mm-hmm.
So,
What kind of changes did they have in the community to prepare for it?
well, I'm not speaking for Thunderchild First Nations. I'm speaking for where I work in Waterhen Lake First Nations. That's where I work. But you're asking me what kind of changes did we make? Is that
Yeah,
what you
like
mean?
how did they start to do things differently?
Well, our work hours definitely changed. We had shorter work hours, and we still do at the moment. We had to close the front doors and screen people, and we still do. We tell patients, clients to call ahead of time, especially if they have signs and symptoms of the coronavirus, and if they do, then we take them to another isolation room and we do our testing there. Yeah, then we recommend they leave through another door. So, and that front door of the health center is locked, so people just can't come and go freely, and their temperature is checked. And if they do come without calling and they're coughing, they're given a mask right away. Yeah. And we hand sanitize. We offered the hand sanitizer to people at the front door to hand sanitize, and we constantly wash our hands, and in between patients we're wiping down the rooms more diligently now, with this COVID. And the janitor as well is cleaning more often. Yeah, so there's a lot of disinfecting, a lot. Yes, we change our masks in between.
What about the whole
Patients as well.
community overall?
Like, how did they respond? Do you mean, or the whole community overall? How they
Like the changes they made, or how they were responding?
Well, they were accepting of. Well, they had no choice really, right, to accept our guidelines in the clinic. So they responded okay to that, and I seen them accepting of it. There was people who wore masks, and there was people who asked for some hand sanitizer. We could only give a little because we only had a little to give to the public as well. But as time went on, we were able to get more masks and more hand sanitizer for the community members, and for other non-essential workers. So that was good, and they used their masks. Yeah. Of course, Waterhen has a radio station, so they were talking about the COVID-19 and how to protect yourself, social distancing, hand washing, all that, and mask. Yeah, and essential travel. But of course, with the changes with our province and the stages they're going through, I think First Nations are starting to, follow those guidelines as well. Yeah. So. But of course there was like drastic changes, right? Like there was no more school for students. Some of the health staff had to take shifts. A few health staff came in the first week, other health staff came in the second week. But the nurses, they just worked right through. We didn't take shifts. We just come to work every day. Yeah. Of course there was no school, so that made a big difference. At first, when the pandemic was called, we started seeing less patients and only emergencies, and we did cut down on some of our services. Immunizations, we don't. That's a given. You just keep going with immunizations for children and school children. But we cut down on, there was a weight loss challenge, so we're not going to be checking weights during the COVID. That's not a service we just don't provide right now, right? Because of the risk factors involved of transmission. So there was some changes like that. And I know the band office too, the administration office, they had took shift work, I believe, as well. Part of their staff came in, and then part of their half a week. Then the other stuff came in, I believe, anyway, at the band office. Yeah. So it was a big difference.
Yeah.
Yes.
And for yourself, staying in touch with family and friends, did that change for you?
It sure did. I was because my husband was going to school in Saskatchewan in March. So I think it was towards the end of March that they took him to school. And he was actually staying in North Balford, and I was staying in Waterhen. So non-off-reserve members weren't allowed to come on to Waterhen. So I ended up staying there in Waterhen by myself for the whole month of April, pretty well, and part of May. Well, pretty well the whole month of May. Because off-reserve wasn't allowed to come onto the reserve, and I was trying to do my part as well, so I just stayed put and did my essential shopping maybe once every 10 days just to go get some groceries. So I stayed in Waterhen by myself. So that was a big change for me. It was lonely, but I tried to keep myself busy, right? Yeah, and I was going to school doing some classes, so that kept me a bit busy as well. I didn't get to see my family, so that was a big change, but I was able to FaceTime with them, talk with them on the phone, text. Yeah, so that made a big difference, as my family likes to gather and eat. So we didn't have any of that. We still don't have that. Yeah. So that's a big change in a lifestyle.
Yeah. So like more isolated.
Yeah, more isolated. Yeah.
Less interaction with family.
Yes, yes.
Yeah. And how did you cope with that? Like, how did you find yourself coping?
At times it was difficult. It was lonely. So for my own coping, I had to do a lot of getting in touch with nature, such as going outside, getting some sunshine, vitamin D, getting some fresh air. And I like to take hot baths when I after work to relax. That helps me relax because sometimes I'm really tired when I come back from work. So, and I also like to meditate. Not to go on my cell phone or watch TV or listen to music. I just need to sit there and be still my mind. That helps. That helped me a lot. And those times, of course, listening to music. I'd listen to music and I'd go on the treadmill and exercise. And I tried not to have too much chocolate. Because I like chocolate. So, and what else did I do? I was in school too, taking online classes, so that kept me busy. I was done my classes after the long weekend in May. So that kept me busy. And I enjoy reading, so I read a book as well. Yeah. And going to work, I enjoy work. So it's a big change.
And like this is part of this project is finding out how, well, especially as First Nations people, how might culture and heritage or that traditional life practices contribute to your resilience to cope with the changes brought up by the pandemic. Do you think that that's been the case for you?
Oh yeah, well I've always practiced my culture and traditions. That's nothing new for me. So during the pandemic I smudged, I prayed, and I still do. And part of that is hoping for how to have compassion and kindness, and showing that compassion, kindness, and all those good things. Yeah. So it wasn't nothing new for me because I practiced those already.
Yeah.
Yeah. Yeah.
And what lessons for the future might come out of this experience for you?
Okay, I wrote a little bit of notes here, so I'll just refer to them. Well, one thing I have noticed not just with myself, but with my family and other people, because I deal a lot with people on a daily basis, right? Not just in my workplace, but in my own personal life. I've lessons that I think I've learned from this experience is that to stay home and enjoy my home surroundings, my home environment, because I live in Waterhen, but I also have a home in North Belfort, so I go back and forth. And just staying put that 1 month, not going back to North Belfort, I really got to, I don't know, feel the house I'm in, even though I was alone. But and just to look at other people and look at these families, young people with, a lot of children, and staying home. I can imagine that'd be hard. Yeah. even just staying home and cooking 3 meals a day or whatever for myself and my partner was a lot of work. Yeah, and and for families who have a big family, that's a lot of work. Yeah. So I think it's just that staying home and enjoying your surroundings and enjoying your family. Yeah, that's what I've come to experience. Yeah, and to fix your house. I know I'm speaking for myself. I've neglected some things, and I was able to clean house, fix things. Wash the curtains, those types of things. Yeah. So, taking the time to look after those things for sure. So those are lessons for me. And do those things that you enjoy and that you didn't take the time to do. That's a lesson, I feel. Like your enjoyment, such as sewing. Sorry, I see the beach here. Sewing, beading, those types of things. Yeah.
What about, do you have anything to add for how do you think it would, what would you think would come out of this experience for your community or society as a whole?
Well, the community needs to come together to help each other out and to raise the children in a positive environment. As the saying goes, it takes a whole community to raise a child, right? And I believe that being isolated like that in a community, it really opened my eyes, and I'm sure others' eyes, that we're all in this together and we need to support each other and we need to help each other out and be kind to each other. Is what I see with our communities. Yeah.
And what do you think you'll remember most about this time?
Just before I go on with that next one, I just want to say society as a whole.
Oh, okay.
Yeah. I believe is being taught a lesson to take care of our universe, because we take things for granted, such as traveling all the time, for unnecessary things, and we burn lots of gas and fuel emission and all of that, right?
Yeah.
And I find that money is our driving force for a lot of things, that we forget what's important, what's in front of us that's important, right? And we put the universe at risk for our own power and money. Yeah. So it's what I see personally. People might disagree, but yeah. And what will I remember most about this time? Definitely the social isolation. Yeah, and wearing a mask all the time, because I wear a mask because I'm a healthcare worker, so I'm always at risk of getting the virus. So I don't know because some people are asymptomatic, they don't have signs and symptoms of the virus, and I could be carrying it and I wouldn't even know it, and I could infect others, my loved ones, and people who come see me that are ill. I could easily give it to them. So that's why I wear a mask, to protect others. Not that I'm saying I have the virus, but that's my logic to wearing that mask, is to protect others, because I work in high-risk situations.
Yeah, that makes sense.
Yeah. And just the fear, the fear that this virus is out there and that your loved ones can get affected and they can die from this illness. So I'll never forget that. Yeah.
Is there anything else that you'd like to mention?
Yeah. Well, we're definitely going through history, you know. This will be down in the books, this pandemic. So, because our last pandemic was the Spanish flu, so this flu is so similar to the Spanish flu. We don't have no antiviral drugs or a vaccine for this virus. Yeah. So I'm sure it's going to hang around for a little bit longer before it goes away.
Yeah, and they say there might be a second wave.
Yes. Yeah. Well, usually with viruses that are pandemic, there's usually a second wave. Like with the H1N1, there was a second wave. The Spanish flu, they had a second wave and a third wave.
Okay.